In a world where diabetes is steadily on the rise, understanding its early symptoms and taking immediate action has never been more crucial. Diabetes, a chronic metabolic disorder characterized by high blood glucose levels, is not only prevalent but often advances silently, gradually impacting organs, nerves, and blood vessels. While diabetes may progress quietly, it leaves traces, early warning signs that, when recognized and addressed, can change the course of one's health. The condition doesn't appear overnight, and it's in these subtle changes that one can detect the beginnings of insulin resistance, prediabetes, or even full-fledged type 2 diabetes. Identifying these signs early is not only a call to action for those at risk, but also a beacon of hope, as early detection can lead to lifestyle adjustments that delay or even prevent the disease from progressing. The early signs of diabetes can often mimic other health issues or be dismissed as minor inconveniences. However, each of these symptoms tells a deeper story about the body's struggle to regulate blood sugar. Among the first clues to this invisible battle within the body is unexplained weight gain. Though often overlooked as a common side effect of aging or lifestyle factors, unexplained weight gain can be an early indicator of insulin resistance. Insulin, a hormone essential to processing glucose, plays a dual role in the body's metabolic regulation. When insulin levels rise due to insulin resistance, the body starts to hold on to fat, contributing to gradual, often inexplicable weight gain. This seemingly unimportant weight gain may signal a metabolic imbalance brewing within, particularly in individuals who are already maintaining a balanced diet and exercise routine. Over time, weight gain caused by insulin resistance may signal a move from prediabetes to type 2 diabetes if left unaddressed. Another early warning sign that often goes unnoticed is the darkening of skin, particularly around the neck, elbows, knees, and armpits. Known as acanthosis nigricans, this skin condition manifests as darkened, velvety patches and is often associated with high insulin levels. These patches develop as the body struggles with insulin resistance, a precursor to diabetes, in which cells become less responsive to insulin's effects. Acanthosis nigricans can occur even in individuals who are not yet diagnosed with diabetes, and its presence is a clear sign to consider blood glucose testing. The darkened skin, however subtle, is a biological red flag, often serving as an early indicator for those on the path toward type 2 diabetes. Unfortunately, the cosmetic nature of these skin changes means they're often treated superficially or attributed to skin conditions unrelated to internal health. Just as the skin can reveal internal imbalances, the sudden appearance of skin growths, similar to warts or small pimples, may indicate elevated insulin levels. These growths, although benign, can indicate an underlying metabolic disturbance. High insulin levels create an environment where cells multiply at a faster rate, potentially leading to small skin growths. The emergence of these growths, particularly in clusters, highlights the body's metabolic imbalance and can be an early warning that requires medical attention. Although they may appear harmless, these growths are often the body's attempt to signal a need for deeper investigation into insulin and blood glucose levels. Less visible but equally impactful, mood swings can also serve as an early indicator of blood sugar imbalances. Unlike other physical symptoms, mood swings are often attributed to stress, lack of sleep, or life circumstances. Yet, unexplained emotional fluctuations may be tied to unstable blood glucose levels. As glucose is the brain's primary energy source, erratic blood sugar can disrupt mental stability. Hypoglycemia, or low blood sugar, can lead to irritability, confusion, and even aggression, while hyperglycemia, or high blood sugar, can cause fatigue and a general sense of unease. The correlation between blood sugar levels and mood is complex, but studies suggest that unstable blood sugar directly affects neurotransmitters, leading to emotional highs and lows. Over time, the blood sugar imbalances associated with diabetes can create a cycle of mood swings, anxiety, and even depression. Memory lapses and cognitive difficulties are other lesser-known symptoms that often accompany the onset of diabetes. Known as diabetic brain fog, these symptoms arise as fluctuating blood glucose levels begin to interfere with cognitive functions. The brain is highly sensitive to changes in glucose levels, and unstable blood sugar can disrupt concentration, memory recall, and focus. Research shows that hyperglycemia and insulin resistance can lead to inflammation within the brain, contributing to cognitive decline. Furthermore, consistent blood sugar imbalances have been linked to a decrease in hippocampal volume, the part of the brain responsible for learning and memory. For individuals noticing these cognitive changes, such symptoms might be subtle yet persistent reminders that the brain's health is intrinsically tied to blood glucose regulation. Although these early signs may appear unrelated, they are interconnected by a common underlying issue: the body's struggle to regulate blood glucose. Each symptom reflects a body under stress, coping with insulin resistance or the onset of diabetes. The prevalence of these early signs is a stark reminder that diabetes does not suddenly emerge. It is rather a gradual process, one that begins with insulin resistance, a condition in which the body's cells become less responsive to insulin, the hormone responsible for helping cells absorb glucose from the bloodstream. In the absence of intervention, insulin resistance leads to higher circulating insulin levels, which in turn perpetuate the cycle of glucose imbalance, weight gain, and inflammation. Left unchecked, this resistance ultimately leads to type 2 diabetes, where blood sugar levels remain persistently high, wreaking havoc on various organ systems. However, early detection, along with lifestyle changes, can intercept this cycle. Research consistently supports the power of lifestyle interventions in reversing insulin resistance and, in some cases, preventing the onset of type 2 diabetes altogether. A balanced, nutrient-rich diet, regular exercise, stress management, and adequate sleep are pivotal in restoring insulin sensitivity. Eating a diet low in refined sugars and processed carbohydrates can help the body manage blood sugar more effectively. This dietary adjustment reduces the pancreas's burden to produce insulin, slowing or even halting the cycle of insulin resistance. Physical activity, particularly strength training and cardiovascular exercise, is equally crucial as it enhances the body's glucose utilization and improves insulin sensitivity. Sleep, often overlooked in metabolic health, is fundamental, as sleep deprivation has been linked to higher insulin resistance and cravings for sugary foods. For those who may already be in the prediabetes stage, monitoring blood glucose levels and seeking medical advice is essential. Many physicians recommend regular glucose tolerance tests or HbA1c measurements to track blood sugar levels over time. Early interventions, including medications that improve insulin sensitivity, can be prescribed for those at high risk. Still, lifestyle modifications remain the foundation of diabetes prevention and management. Aside from medical management, individuals can adopt daily habits to stabilize blood glucose levels. Small, frequent meals rich in fiber, lean proteins, and healthy fats help prevent the blood sugar spikes and crashes associated with mood swings and fatigue. Stress reduction techniques such as meditation, yoga, or even mindful breathing can minimize cortisol levels, a stress hormone that can exacerbate blood sugar imbalances. Regular monitoring of these lifestyle elements can offer individuals insight into their blood sugar trends, helping them to make informed choices that support stable glucose levels. The journey from insulin resistance to diabetes is not inevitable, nor is it irreversible. With a growing understanding of diabetes' early symptoms, individuals can take proactive steps toward prevention. In a world where diabetes continues to affect millions, recognizing these subtle signs is a form of self-advocacy, empowering individuals to prioritize health before complications arise. Although diabetes is a formidable condition, it can be managed and even prevented through lifestyle adjustments, medical guidance, and a commitment to self-care. Ultimately, these early signs serve as an invitation to pay attention, listen to the body, and act on its subtle messages. By understanding these warnings, individuals can harness the power of early detection and chart a course toward sustained health, helping to reduce the global impact of diabetes one choice at a time. Thanks for tuning in. If you found this video helpful, don't forget to give it a thumbs up and hit that subscribe button for more insights on health and wellness. Remember, catching these early signs of diabetes can make a huge difference, so keep an eye on your body's signals and stay proactive about your health. Until next time, stay informed, stay healthy, and take care.